Hello, my name is Dr. James Perkins. I'm a naturopath and a chiropractor, and I'm the Clinical Director of Alternative Health Solutions in West Bloomfield, Michigan. I'm compelled to do this little video on hiatal hernia because of what I've seen clinically over the last 33 years. I finally think this would be a great thing to do. I can't tell you how many, literally hundreds of people have come into my office with a hiatal hernia. And almost every one of them has been told that there's nothing that can be done for them short of surgery. They suffer with this, and it is for some reason, for some people, a very debilitating condition. For others, it's a transient condition that just becomes an annoyance. But it can become quite serious. There are some visceral adjusting techniques that most chiropractors know how to do, and people just are unaware that there is anything that can be done. So we want to educate you a little bit on that today. So I'm just going to show you quickly what a hiatal hernia is so you understand. Now, a lot of people have been told they have a hiatal hernia and they've never been explained what it even is. So let me go ahead and just, on this little drawing here, just draw in some anatomical parts and show you in a very brief, simple way what a hiatal hernia is. So here on this person, we will draw in the diaphragm, and there's our diaphragm. And the diaphragm has a hole in it right there where the esophagus comes down from the throat into the stomach, like that. Now, this diaphragm marks a demarcation where tissue changes from the esophagus, which has ring-like cartilage, to very soft tissue in the stomach. So the tissue in the stomach, on some people, has an opportunity to bubble up into and next to the esophagus, creating pressure. Like that, it bubbles up. And it creates pressure squeezing the esophagus together and blocking food from going down into the stomach. So the food sits right here, and it digests right there. Food is not supposed to digest in your esophagus. It's supposed to come down into the stomach and be digested in the stomach. So this is a paraesophageal hiatal hernia. Some people have that. Para in Latin means next to, so it's kind of next to the diaphragm or the esophagus squeezing it. Other people will have a telescoping esophageal hiatal hernia, where the hiatal hernia actually ends up bubbling up inside the esophagus like that, sometimes totally blocking the ability of food to get down. Now you end up with a lot of acid in here, and that ends up being gastroesophageal reflux disorder called GERD. And a lot of people go to the doctors, they're told, oh, you have GERD. So they put Trinexium, Prilosec, Propulsid, Tagamet, Zantac, 100 different things. And really what's happening is these drugs are supposed to block the acid. The problem is you still have the food sitting in here. So eventually, after the side effects of the medications get so bad, the patient has difficulty taking these products, and they stop and they think there's nothing that can be done. So in just a moment, I'm going to show you how a trained visceral adjuster will adjust a patient. This is not to be tried at home, and it's not to be, I'm not teaching on this film. I'm showing you what a trained professional can do, and then I'm going to show you a home method that you can use with the patient who has the hiatal hernia can actually do this on themselves. It's a self-treatment, and it works quite nicely actually. So I'm going to show you that too. So we're going to go to that right now and show you what that demonstration looks like. Okay, so a patient comes in suffering from hiatal hernia. Oftentimes they've been told that there's nothing that can be done about it, but we're going to show you how a practitioner who's trained in visceral adjusting may be able to help relieve the symptoms of a patient suffering with this debilitating disease, because oftentimes it takes over their lives when it's really bad, or it can be transient and come out of the clear blue sky and cause some real difficulties. So what we're going to do is we're going to recognize our anatomical locations, and we look at the bottom of the rib cage just to the left of the xiphoid process, is where the stomach material is bubbled up inside the esophagus. We're just going to literally take a tissue contact. We're going to be right on the tissue of the stomach. And with the patient having deep breaths in and out, we're going to gently keep pushing little by little, little by little. Take a deep breath in again and out. And we just keep doing this and put each time I go a little bit farther, deep breath in again and out. And at the end, when we feel like it is a good time, good opportunity to release this, deep breath in again and out. We give 3 short bursts like that, little energetic bursts. And it is not a difficult, not a painful release, but the results are tremendous. So short of surgery, this is something that can be done on a regular basis for people who suffer from this disease. And the patient can also learn to do it themselves. I don't recommend others do this for them unless they're trained in visceral adjusting. Some people get a little heavy-handed. You don't need to be in this case. And these are very delicate structures around these ribs. So the patient will be taught and trained to make a fist and take her little knuckle here and put that just where the ribs come up into this V shape, and just to the very left of the center line of that knuckle will go in. With their other hand, the idea here is to relax the area, so take a deep breath in, and then when the breath goes out, relax and just start massaging down like that. Get another contact, deep breath in, massage down. She'll demonstrate this. There. Try it again. Deep breath in, massage down, give it a nice push. The patient may have to do this 20 or 30 times. Easy, very easy to push yourself away from a table that you're eating at and just do this to yourself. Most people don't even know what you're doing at the table. They're just watching you release this tissue, and oftentimes the patient will actually feel the food releasing down, and this works quite nicely. So again, these are some things you can do at home to help you with your hiatal hernia, and then find a practitioner who can manually adjust the viscera for a hiatal hernia. This concludes the video. Good luck, and certainly give us a call if this is your condition, because you've probably been told there's nothing that can be done about it, but there is a lot that can be done, and this condition can be extremely dangerous. Hiatal hernias have been known to cause death, not on a lot of the people suffering from it, but certainly it can over time really be a problem. Oftentimes people will get this reflux esophagitis and have heartburn so bad that it's almost like they don't want to go out to eat with people because they're embarrassed, or they don't want to eat food because it gets down here, and pretty soon that detracts from your nutritional absorption of food, and it becomes quite a big problem. Oftentimes it leads people to take drugs for this because they're trying to stop the acid in the esophagus, and that really is futile, because these drugs were made to stop acid in the stomach down here, not up here in the esophagus. So to take these drugs is just nothing more than just waiting for the side effects of the drugs to kick in, and then you got another whole big problem. So visceral adjusting is really the best way to do it. It's physical manual adjusting of the viscera of the gut, and there's a lot of different components that people who learn visceral adjusting, like myself, can do. So if you need other visceral adjusting and are having a lot of problems with digestion, even through here, and it's not a hiatal hernia, we can help you with that too. So call now, don't hesitate. We want to correct this as soon as possible. Alternative Health Solutions, 248-855-8707, and let us help you with this. There is relief for this. So thank you.